Welcome to the Fibromyalgia Podcast. I'm Tammy Stackelhouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with FibroFog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast with Tammy Stackelhouse, Episode 5. Welcome to the Fibromyalgia Podcast. I'm Tammy Stackelhouse, your coach. And today I am talking with a friend of mine, Dr. Ginevra Liptan, who is the medical director of the Frida Center for Fibromyalgia in Portland, Oregon. She's also the author of several books, including the Fibro Manual, which is a great manual both for you and your doctor. In fact, I think that's a subtitle, isn't it?
Yes, it is.
I realized as I was saying that, oh my gosh, I think I just gave him the subtitle. But it really is. It really is.
Thank you.
So today what I would like to do is just talk through from a doctor expert's perspective on what fibromyalgia is. So let's actually start. Actually, I'm going to back up a little bit. I'm going to spring this on you, but I hope it's okay. You are not just a doctor; you're also a patient. So would you share just a tiny little bit of your fibro story?
Sure. So I was in medical school. I was pretty healthy, and I injured my neck when I was weightlifting, and it just didn't get better, and spread to kind of more widespread pain. And then I got really fatigued and foggy, and I had to take a leave of absence from medical school. I didn't even know what was going on. It took me a long time to get the diagnosis, and then began my struggle to find things that helped and to find doctors or healthcare professionals that could help me. So I remember vowing to myself, if I could get myself better enough to go back to med school, that I was going to devote my whole career to trying to help other people so they wouldn't end up in that place that I was, where I didn't know where to go for help, and I didn't know what to do to help myself, and I didn't feel like the doctors had anything to offer me.
Right. And I think too, didn't you kind of keep that diagnosis secret because it sort of wasn't
Oh yes, there was a big stigma associated. I mean, there still is somewhat of a stigma associated with fibromyalgia, but it was so much worse. This was, almost 20 years ago now. And in the medical field, when I came back to medical school, I remember hearing one of my attendings, one of my teaching doctors, who had previously really respected his opinion. And he said in a lecture, fibromyalgia, I don't believe it exists. It's not real. It's just all in their heads. And here I am sitting there with fibromyalgia in the audience. And I realized right then, I have to keep this secret because my medical colleagues were going to judge me. And it felt like this whole secret life I had to lead. It was really ridiculous and painful. It made it so much harder. And then I didn't actually come out as having fibromyalgia until the end of my residency. Literally on the last week of my residency, I had to give a grand rounds, and I did it about fibromyalgia. And then the big reveal was that the person I was talking about was me. And then, of course, I started sobbing in front of all my colleagues. So,
oh no,
really embarrassing. But they were actually really, really surprisingly, these are people that have been in the trenches with me for 3 years. So they actually really were pretty supportive. And I felt like if I at least changed one of their minds about what somebody with fibromyalgia, their kind of preconceived notion of fibromyalgia, I felt like I had to do it,
Absolutely. And I think that's such a good example of how we educate people around us in our illness by how we live our lives and with what we say and what we do. So I think that's great. So a good place to start then is, what is fibromyalgia? So from speaking as a doctor and a specialist and as a patient, give us the lowdown.
Well, I know you talked a little bit about kind of the research and things that have interested you and that you found to be helpful as far as understanding fibromyalgia in the last episode. The way I've put kind of my personal research into my own, what am I experiencing in my body? What is going on in my patients' bodies? And then what does the research show us? I've found it really helpful to sort of think about what's happening in the body in fibromyalgia like a chain reaction. And the chain reaction starts in the brain, where the part of our brain that regulates, are we safe or are we in a dangerous situation, has gone haywire. And it gets kind of triggered by something, usually a trauma or an injury or an illness. And then it just gets stuck. Like the button is stuck, it doesn't go back. So then you end up with this kind of constant danger response, constant fight or flight signaling from the brain down to the body. And what that does is set off a whole host of kind of this chain reaction. The first thing is sleep. Sleep is totally impaired in fibromyalgia because our brain is trying to keep us in the lighter stages of sleep so that we're not, so we don't get attacked by the saber-toothed tiger right outside the cave. So sleep disruption is huge. And a lot of the studies have shown that people with fibromyalgia, we don't get into the deeper restorative stages of sleep. So that's pretty key to I work a lot on trying to help people improve their sleep quality. The other thing that happens when kind of the brain is constantly in this fight or flight mode is that we tense our muscles because our body's trying to actually protect us so that we can either run away or fight. Now, in a short, for like a few minutes, that's okay. But when your body is doing that all the time subconsciously, it creates a huge amount of muscle pain and inflammation and tension. And we develop trigger points, painful knots in our muscles. Studies have shown that people with fibromyalgia on average have 13 trigger points in their muscles, as opposed to healthy people having maybe 1 or 2. So I feel like it's really important to address our actual muscles in fibromyalgia, to really do things, gentle movement, stretching, yoga, myofascial release, to try and ease that tension, because we really are, it's not conscious, but we are really, really, really tense. And we're doing that even when we're sleeping. So I can tell almost when I lay my hands on somebody, when I'm seeing them as a new patient, I can almost tell if they have fibromyalgia just by touching their upper back muscles. Because it feels, I call it the trapezius of steel. It's just like.
Yeah, that description is so perfect. I know exactly what you mean.
Familiar with it? Yes. Yep. And it's not good. It's painful. And then I'm pressing, that's actually where some of the fibromyalgia tender points are that we use to diagnose it. And, I press on somebody's right there and they're like, oh, so sleep disruption leads to fatigue and brain fog. And then the muscle tension really leads to inflammation, tightness, dysfunction in the muscles. And then we are really prone to injuring ourselves. Any little kind of, activity, we're really prone to developing repetitive stress injuries, things like that. And then we're not meant to live in that fight or flight mode all the time. So then it also sets off, our inflammation levels are higher. It affects our hormones. It affects how we process and kind of gather nutrition. So it affects our digestive system. So part of how I treat fibromyalgia is trying to kind of go back to this first part of that chain reaction, improve sleep, improve muscle health, improve nutrition, reduce inflammation, restore hormone balance. That's kind of the approach that I take. And, everybody looks at the scientific and research data is out there for fibromyalgia. Everybody looks at it a little bit differently. And the thing that most doctors really focus on is that end result of the chain reaction, which is the hypersensitivity or increased sensitivity to pain. So with fibromyalgia, a light touch will feel like pain. So the signal sort of amplified as it goes up through our nervous system. And anybody that's seen a Lyrica commercial knows that is the cause of fibromyalgia, right? That's what they say. And that is absolutely part of it, but it's like the end result. And if we're just looking at the end result, you don't get as good of benefits as if you start earlier in that chain reaction. And then, of course, you also need to address the pain hypersensitivity, but we do a lot better if you first start with addressing sleep. That is really, if there's one thing I want people to take away from this interview is if you have fibromyalgia, talk to your doctor, work with them on getting better sleep. Sleep quality is key. And you found this, right? With
Oh, absolutely.
your sleep.
Yeah. Yeah. And when I'm working with clients too, it's like if there, we can do a lot of stuff, but if we don't get the sleep aspect under control, then at best you're treading water.
Yes,
You don't
exactly.
actually make progress.
Yes, and things like myofascial release, manual therapies you don't get as much benefit, or even chiropractic. Like if you're doing some kind of manual intervention, but you're not getting into the deep sleep that you need to that night, it's not going to hold as long. So I often tell people, don't waste your resources, don't waste your money on doing a whole bunch of myofascial release or acupuncture or chiropractic until you have first focused on getting your sleep, so that you can then kind of get more benefit from any manual therapy that you're getting, because it's expensive and sometimes insurance isn't covering it. And, I really want people to try and focus their resources on what's going to give them the most bang for their energy buck, so to speak. So,
Right.
sleep.
Absolutely. Sleep is big. So I know you have done some of your own research on fibromyalgia. And so tell us a little bit about that. It's more in the muscle realm than the sleep realm.
It is. It is. Although I would love to, it would be really cool to do some sleep studies. But when I was working up at OHSU, Oregon Health and Sciences University, I got a grant to study how a treatment that works on the fascia might help fibromyalgia. So I looked at myofascial release compared to regular relaxation massage, and so people with fibromyalgia either got myofascial release or massage, and saw how it affected their pain levels. And the reason why I wanted to study that so badly is because for me, myofascial release, which is really kind of gentle, slow pressure on the muscles that really softens and allows the fascia, the connective tissue, to kind of release, that's what got me back to medical school. By far, myofascial release was I say somewhat hyperbolically that it saved my life, because that was the first thing that actually gave me some pain relief. And it was the first thing that gave me some hope. My neck had hurt for 18 months. Nothing had helped. Everything was making it worse. And I did a few myofascial release sessions. And for the first time, I didn't have that same pain in my neck. And it was like all of a sudden the clouds parted. And I was like, wait a second, this actually could really help people. So then I, of course, go down to the library at medical school, like myofascial release, fibromyalgia, nothing. Nobody's looked at it. So that's what kind of inspired me, get back to medical school, do my training. Then I was like, I'm going to look at this. So what I found was that folks that got myofascial release did get more benefit than those that just got Swedish massage. Both groups reported some benefit, but the myofascial release group did better, had better pain reduction, and also had more sustained benefit. So my study was just very small, and with small studies, you can't really make huge conclusions. You can sort of say, well, this sort of hints, it's really kind of more of a pilot study. But right after my study came out, a huge, beautifully done study from Spain came out looking at myofascial release for fibromyalgia. And I was like, oh, I should have done that. But it was perfect timing. And they came out with this really, really beautifully done, very large study looking at myofascial release, 20 sessions for fibromyalgia. And they found significant pain reduction. And here was the really cool part, is that even after the study was over, a month after people's last sessions, they still had pain benefit. 6 months after their last session, they still had pain benefit. So you actually got some sustained benefit. It wasn't just while people were doing the treatment. It actually improved, and they did better going forward without having to continue the treatment. And I was like, hallelujah, this is it. So for me, myofascial release, I highly recommend it for fibromyalgia. Everybody's different, of course. Our body responds to different things. But based on that Spanish study and my experience and my clinical experience, I feel like myofascial release, particularly the John Barnes style, and if you want to know more about it, myofascialrelease.com. I think that's a really, really good place for most folks with fibromyalgia to look at.
Absolutely. I think that the aspect of the study that showed the sustained relief, I think, is huge. I've talked to so many people who were like, yeah, massage, it helps me feel better, like for a
Like
couple
a day.
hours
Yeah.
or till tomorrow.
Right. And who can afford to do, I mean, you can't,
You
that's not a
can't do that every
sustainable.
day.
No, no. Yeah. So
Yes.
we
And
want things that give sustained benefit.
yep, exactly, which is awesome. The other thing I just want to pause here and mention for people listening in is that I always do full show notes on these episodes. So all of the links, the studies that we're talking about, you'll be able to go to fibromyalgiapodcast.com and see all of those. So don't feel like, oh, shoot, I missed that. Or how do I spell myofascial? Don't worry, we got you. It's just go to fibromyalgiapodcast.com/5 to get to this episode, the 5th episode, and we'll have all of that for you.
Beautiful.
So, what research, I mean, obviously this was super exciting, but what other research studies have you seen that really excite you in terms of, giving you some hope for either treatment options or figuring out what caused this or whatever?
Well, there have been some really interesting brain studies lately looking at inflammation in the brain in fibromyalgia. And so it's actually been pretty hard to study because most people don't want you to like take a biopsy of their brain while they're alive.
Yeah, I'd be in that camp.
Yeah, people aren't usually super willing to donate part of their brain for research. However, in the past few years, some very smart researchers have figured out how to do it in a non-invasive way. And the one that I think is the most fascinating is they actually looked at the fluid that surrounds the brain. And if you think about it, the fluid that surrounds the brain is going to have pretty much the same kind of chemical makeup as the brain cells, right? Because it's in communication with each other. And what they found in the fibromyalgia brains were higher levels of inflammation. We already knew that there were high levels of substance P, and that's substance P for pain in the fibromyalgia brain, but we didn't know that there was inflammation. And inflammation is basically activation of your immune system. And that can be for a good cause to, fight off a cold virus, or it can be unhealthy and a kind of an abnormal response. And that's what we see in fibromyalgia. So what that means is it gives us another treatment target. And that's where it gets kind of exciting is, okay, what can we do to kind of calm down the inflammation in the brain? And that's a different approach than anything we've tried before as far as medicine for fibromyalgia. Things like Cymbalta or Lyrica, those are just working to kind of calm down the pain signaling, that kind of excess hypersensitivity or volume issues. But it's not dealing with like that root cause, what's really triggering it or driving it. So treatments that can direct towards brain inflammation, that opens up a whole new world. And there are some things from like the alternative medicine world that we know can help with brain inflammation. And low dose naltrexone is one of those. CBD, which is near and dear to my heart, can also help reduce brain inflammation. Things like turmeric, fish oil. So I like the idea of kind of looking at, okay, what can I do to not only reduce inflammation in my body, but in my brain? And Dr. Jared Younger is doing a lot of really interesting imaging studies, looking at other ways to kind of piece out what parts of the brain might be inflamed, more inflamed, what's triggering it. And it looks like it's really due to the activation of the glial cells, which are normally sort of quiet cells that sit there and kind of protect the neurons. But in abnormal inflammation and chronic pain, those glial cells get activated and they're just kind of sending out this chemical inflammatory soup. Basically, they're like, if you imagine the brain is kind of like an open wound, they're just kind of squeezing lemon on it, It's like, ow,
That sounds
ow,
painful.
ow, ow. So that gives like a target to say, okay, we have to figure out why the lemon, and then counteract it and lower the inflammation levels in the brain. So that's where it starts to get pretty exciting for me. And doing combinations of things, like maybe having somebody on low dose naltrexone plus CBD, plus maybe there's some other, pharmaceutical brain anti-inflammatory agents that we can develop. Maybe that would be like the combination that would really quiet the pain levels down. And that could be really, really exciting.
Yes, that is super fascinating, and I know that low dose naltrexone is often mentioned when we're talking about glial cells. So we will definitely have to do a future episode talking about LDN and that whole
Yes,
thing.
you should
But
interview Dr. Youngers. That would be really cool.
yes, he is on my list
All
actually.
right. He's great. He's
So,
smart. He's figuring this out.
yes, which I think is super exciting, and I love the fact that it's something from a different perspective, right?
Yeah.
Rather than just looking at the same old thing
Right.
and trying to, I always use the analogy of fibromyalgia being like the elephant with the blind man, right? Like it's
Right. Yes.
we think it's this and we think it's that, and it's like we need to see more of the whole elephant, and I feel like that's what this is doing.
That is a genius way to describe it, because you're right. Like the neurologists only look at this part of it, or, the rheumatologists see this part, or, we're just looking at the sleep. But you're right. It's the whole picture. And how does it kind of all tie together? Like seeing the whole elephant, and then you could actually treat it more effectively. Analogy. I like it.
Yes. So, what parts of the elephant do you feel like we haven't looked at yet? What kind of research do you think we still needs to be done? Like from your experience as a patient and as a provider, I know that there's a lot of anecdotal things out there that we do that haven't been studied.
Unfortunately, almost everything that I am doing as a fibromyalgia specialty doctor is more in the anecdotal realm. So the first thing that I think we really need to do is we need to dial into exactly which medications and treatments improve fibromyalgia sleep and by how much, which are the right medications, the right treatments, the right approaches. Really doing like before and after sleep studies, that would be really interesting to me. What does Lyrica do for sleep? So we know there's some data that Lyrica helps improve sleep quality. Well, let's give 10 people fibromyalgia, let's do a sleep study before Lyrica and then a sleep study after. What actually happens to the brain waves? Then we can really quantify and determine, okay, here's what we need to use to help this kind of sleep issue. So that's the first thing that I think needs to be done. The second thing is I really want there to be more research on the actual what's happening in our tissue in fibromyalgia. So when fibromyalgia first was being looked at, 30 years ago, because people's muscles hurt, they did a lot of muscle biopsies. And unfortunately, all of those looked normal. They couldn't find anything wrong. So they said, oh, it's not in the muscles. The muscles are fine. It's just in people's brain. Well, if you actually look at what's happening in the fascia, which is the connective tissue surrounding and enveloping the muscle, there's some early studies that show that the fascia is not normal in fibromyalgia, that there's some mild inflammation, that there's some excess collagen, that the fascia is more sticky, so it's not moving or flowing as well, and that is what is generating some of the pain. What we need are some really good quality biopsy studies looking at the fascia, I think. Again, most people don't really want to go around giving samples of their muscles, but more likely than the brain. And I've definitely had patients tell me, like, take a biopsy of whatever you like.
I would just want to figure this out. Take what you need.
Yes. So I think some further research into the fascia would be really interesting. And then the other piece would be kind of trying to figure out things like, what other ways can we reduce inflammation in the brain? So things like LDN, doing a lot more research on that, and maybe even getting low-dose naltrexone to the point where it's been well studied enough that insurance would cover it, that your regular primary care doctor would hear about it. Because to me, to you and I, low-dose naltrexone is like, we've heard of it, we talk about it, oh yeah, LDN. I was recently speaking to a group of students, PA students, and it was 60 of them. And I said, okay, how many of you have heard of low-dose naltrexone? And one person kind of raised her hand. And I was like, okay, these are the future like healthcare providers that are going to be going out in the community. And only one of you has heard about low-dose naltrexone. So we need to do enough studies that we can get it kind of normalized and accepted in conventional medicine. Because right now, it's a very benign harmless treatment that stands to benefit a lot of people with fibromyalgia. It's not an opioid. So why doesn't every primary care doctor know about it? So that's the other piece that needs to happen. Big enough studies need to happen that it can actually get into the kind of the zeitgeist of medicine.
And do you think that that is part of why it's so hard for patients to get good treatment? Because there aren't studies and then therefore doctors aren't aware?
Yes, bingo. And in fact, the best example of this is, and I don't want to open a can of worms, but the opioid crisis, where they're sort of saying the party line is that opioids don't work for fibromyalgia. And they are basing that on studies of less than 100 people total. They're making that recommendation for 10 million of us with fibromyalgia based on the data from less than 100 people.
And if you were doing something like, say, cancer research,
yeah,
and you only studied 100 people, nobody would really be buying that yet.
You can't make a conclusion based on that. So, but unfortunately, what kind of translates into what your conventional doctor knows really comes from very, very small little pockets of information. And if it's not something that is FDA approved, and there's only 3 FDA approved medications for fibromyalgia, if it's outside of that, it's really not, they often haven't heard of it. In fact, if you ask your doctor, hey, do you know about any sleep issues in fibromyalgia? 99% of the time they'll say, oh no, there's no sleep issues in fibromyalgia. Even sleep doctors will say that. And I'm like, are you kidding me? There's so many studies showing that there's sleep issues. But one of the big problems is a lot of these studies are published in journals that people don't read very much. So New England Journal of Medicine, which is the biggest medical journal in the world, most widely read journal in the world. Do you know how many articles on fibromyalgia it has published?
I don't know if I want to know. Are you serious?
I am totally serious.
In the whole history of the journal, one?
Yep.
I can't say what's actually going through my head right now.
Is it an expletive that's going through your mind?
We want to keep this episode rated, for the general public.
Yeah, no. So right there, that's the challenge, right? Is so that doctors are not, through the channels that they are accessing information, they are not learning about fibromyalgia, and they're not learning about the new treatments for fibromyalgia. They're stuck 10, 15 years ago. So what that means is that fibromyalgia patients have to be the one that bring the information to their doctor. And that was part of what I tried to do in my book, the Fibro Manual, was to have actual resources that they could bring in and say, hey, here's this article, here's the abstract about low-dose naltrexone for fibromyalgia. Would you consider prescribing it for me? And then your doctor might look at that, which was a well-done study done by doctors at Stanford. It was very, the science is sound. And maybe they'll look at that and say, oh, okay, well, let's give it a try. Because they're not going to read about it in the New England Journal of Medicine.
No, I guess not. So in our next episode, I'm actually going to talk about the role that we have as patients in our own healthcare. And this is one of those things that Dr. Liptan's hitting on right now, is that it's our bodies that we're living in, right? And we've got to bring information to our doctors if we have it. We can't assume that they've got all the answers. This idea that doctors know everything.
And there's so much information there's so many illnesses doctors have to know about. You know what I mean?
I can't even imagine trying to keep up on everything, especially if you're primary care. You basically have to know this much about a whole lot of stuff, right? And
Totally.
You can't really get into it's a full-time job for me keeping up on fibromyalgia. I can't even imagine.
Imagine trying to do that while you're also keeping up on, what's the best way to screen for cancer, treat high blood pressure, treat diabetes, So I always ask people to keep in mind that their primary care doctor, who usually primary care doctors are the ones that are trying to help with fibromyalgia, that they are allotted maybe 5 minutes a patient. They are swamped. The healthcare system is really struggling right now, and doctors are really overworked and overwhelmed. So not that that's an excuse, because certainly you deserve to be getting good care from your doctor, but kind of trying to partner with them and say, hey, I know we've only got 5 minutes today. Would you consider reading this, as opposed to like, why are you not giving me low dose naltrexone? You know what I mean? There's like that kind of partnering is really, I mean, it's really key. You catch more flies with honey than vinegar, right?
Yes, exactly. And I've always said that I would much rather have a doctor who just like treated me with ordinary human respect, right? Like listened to what I had to say, believed me when I told them things, and had an open mind for anything that I might bring in, than
Yeah.
thought they knew it all.
Me too. That's exactly what I want in a doctor. And that's what that's what I try really hard to be. I have to say that a lot of what I have learned over these past 10 years of practicing and treating fibromyalgia is, some of it's been brought to me by patients. Like I had never heard of that. Let me look into that. For example, infrared, like using infrared saunas and treatments. It was a patient that came in and said, this is really helping me. It really helps me. And I'm like, wait, what is it? Let me look into that, And then I tried it for myself. And then now I know who to recommend it for. If you got a lot of joint pain, then try infrared. So it is really a mutual kind of back and forth and partnership. But it can be challenging to find that right provider to partner with. So I bet in your next episode, you'll have lots of tips about how to do that and how to advocate for yourself and, get the care that you deserve.
Yep, exactly. So where do you see fibromyalgia going from this point forward? Where do you think we're headed?
So I think that we are in a good trajectory for a few reasons. One, the stigma of fibromyalgia is much, much lessened. Honestly, Lady Gaga has helped us with that. Having someone that is a celebrity and say, I have fibromyalgia, kind of normalizes it and makes it something that's not something we need to be ashamed about, So I think that for our entire community dealing with fibromyalgia, whether or not you like her music, you have to like that she is at least normalizing and kind of bringing it into the zeitgeist. People know about it now. And it's not kind of a forbidden, shameful thing to talk about. So that's only going to help things. The other thing that is really kind of encouraging is that I think that within the next few years, we are going to have a blood test. There's a couple different potentials. I think we're going to have some really discrete, like accepted, this is a blood test that diagnoses fibromyalgia, so that there's no more kind of gray zone. And I think it would help with disability cases and really making the diagnosis much quicker, so that people aren't having to see 8 doctors and take 5 years before they get a diagnosis of fibromyalgia.
And those are real statistics. If people were wondering, that wasn't just something she just made up. Those are the actual statistics.
It's sad.
8 years and at least 5 doctors.
So my hope is that within a few years, there's definitely a few contenders out there as far as blood tests, but I think we need to, they need to kind of be a little bit more further studied so they can be accepted and make sure that the science is sound behind them. But that will make a big difference. The one piece where I can foresee some struggle is in the funding of research. So there's not a lot of pharmaceutical interest right now in fibromyalgia because there's no big drug that they're looking at. And that's really how studies get funded. The government also studies and funds studies, but that has really dropped since the recession. So what we need is some better ways to kind of direct and harness the finances, the interest in studies. Maybe having a research institute that, I don't know, is funded by Lady Gaga. Just throwing it out there. I think that something like that would help to really be able to like just systematically say, okay, how does this treatment help fibromyalgia? What's going on in the brain here? So to really kind of focus it as opposed to being all, little pockets of people looking at different things. Maybe the NIH could do that, something like that, but it probably would have to be a privately funded type institution. So there's definitely a lot of positives, but we really do need to keep the focus on funding and research and bringing the information so that everybody's primary care doctor knows how to treat fibromyalgia. That is my goal. Like, how can I best get that information so that other doctors know how to treat fibromyalgia?
Absolutely. I think that's the thing that actually makes me most hopeful about where we're at right now. Like you mentioned, going and speaking at all the PAs who are up and coming.
Yeah.
And I've been to speak at OHSU and for their medical students,
Yes.
really being able to catch those future providers and give them a little bit of an insight to, here's what it's really like living with chronic pain. Here's the real scoop on fibromyalgia. Here's
Yep.
are the things that actually make a difference for me. And those 3 FDA approved meds are almost never mentioned. Right?
Yep.
So
Yeah.
it gives me a little bit of hope.
Yeah, no, absolutely. Absolutely. And I think that the future generations of healthcare providers in America are gonna be much better equipped.
Awesome.
So yeah, there's definitely reason to be hopeful.
Awesome. So for folks who are interested in connecting with you, seeing more of your resources, obviously go to Amazon and check out her books. The Fibro Manual's out there, and is it
Fibro Food Formula?
Yes, Fibro Food Formula. That is her other book, specifically looking at nutrition for fibromyalgia.
Yep.
And then also you'll find her at fridacenter.com. Are you taking new patients? Is your office taking new patients?
My office is. I am not, but I have a wonderful naturopathic physician who works with me, and she is taking new patients. So yes.
Excellent. So if you are listening to this anywhere near the release of this episode, I know that changes on an almost daily basis on whether you guys are or not, because you guys do such great work. What other resources would you want to mention to people who are maybe listening and, frustrated in their fibro journey and need some help?
So I've got a blog at drliptan.com, and then I actually have a YouTube channel. So youtube.com/Dr. Liptan. I'm trying to have little educational pieces, not overwhelming, but once a week there's a little bit of information that I release. Just trying to kind of keep it informational and fun. So yeah, that's a good resource too.
Awesome. And as I said earlier, we will have all of these links in the show notes at fibromyalgiapodcast.com/5 for episode 5. And thank you so much for joining me and doing this. I you know how much I love you. So.
Well, I love you too. Thank you so much. Thank you for having me. I'm excited you're doing this podcast. It's
awesome. Thank you. Thank you so much. So this wraps up our episode 5. And as I said before, I will just say again, fibro brains, we need to hear things more than once. I always have show notes and resources for each episode at fibromyalgiapodcast.com. And if you have any questions or something you'd like to see or hear about on the show, you can let me know through that site as well. See you guys next time. And that wraps up another episode of the Fibromyalgia Podcast. If you're ready to see if working with a fibromyalgia coach can help you feel better faster, visit fibromyalgiapodcast.com, where you can schedule a complimentary consultation to explore your options. During this call, we'll discuss your fibromyalgia journey, what your needs and challenges are, and give you recommendations on how to reach your goals the quickest way possible. Thank you for tuning in today, and join us next time as we explore more ways to help you take back control of your life and health. My music and sound editing were done by Daniel Munkus at Subtle Soup Records. Podcast management and creative copy by Sonia Louise of Performance Podcasting.